Good evening, everyone. Susan Bouillon here. This evening, I am doing my video on therapist sexual abuse. Therapist sexual abuse, also known as professional incest, occurs between a patient and therapist. There are many different forms of therapist sexual abuse. Therapist sexual abuse does not necessarily mean sex. Some therapists don't actually have to touch the client, but they can still cross the boundaries and turn it into something sexual. Some therapists will actually get clients to touch themselves, or will get clients to talk about sexual things and enjoy it in a voyeuristic manner. Other therapists might touch the client and will end up as a mutual masturbation. There are lots of degrees of sexual exploitation that are just as harmful as intercourse, but it doesn't actually have to be intercourse. Many therapists explain or justify their sexual involvement with current patients as being therapeutically indicated and in a patient's best interest. For many therapists who sexually abuse their clients, however, this sexual acting out may stem from a therapist's attempt to meet their own needs for affection, nurturing, or unresolved issues of power in a helping relationship. Studies have shown that between 5 and 12% of psychologists responding to a survey admitted to engaging in sexual practices with their clients. In a study, 20 to 30% of current therapy patients alleged to have been sexually victimized or harassed by former therapists. Clients enter therapy with the expectation that they will receive help and care. Therefore, they usually submit themselves to an unequal relationship in which they view their therapist as having superior knowledge and power. Patients may experience feelings of helplessness, worthlessness, guilt, and depression due to this form of abuse. From a trauma-informed perspective, therapist sexual abuse can create a lot of difficulty for the patient who is seeking help for other mental health issues or seeking help to prior sexual abuse. It can re-traumatize them and cause them to distrust therapists in the future based on their experience. When using a trauma-informed approach, it is important to encourage the patient to have conversations to help them feel comfortable. It may also have to help the client. It may also have help the patient to have someone else present so that they do not feel as though they are in a vulnerable position. The 5 circles of sex can deeply be affected by therapist sexual abuse because a patient trusts their therapist, and to find themselves in an abusive situation can have negative effects on their intimacy, the way that they view themselves, trust, sensuality, and sexualization. The breaking of the trust between the therapist and patient can cause the client to experience negative psychological effects, which in turn will affect many aspects of their sexuality. From a social justice standpoint, therapist sexual abuse is ethically wrong. As therapists and social workers, we have an obligation to treat our clients with respect and to encourage them to heal. Professional incest crosses boundaries and manipulates people in vulnerable positions.